If your dentist has mentioned a crown or bridge, here is what these restorations actually do inside your mouth. A crown is a custom-made cap that covers the entire visible part of a damaged tooth, restoring its strength, shape, and appearance. A bridge fills a gap by fusing an artificial tooth between two crowns cemented onto the neighboring teeth, which act as anchors. Dentists commonly use crowns when a tooth is cracked, heavily filled, worn down, or has become brittle after root canal treatment. Bridges are chosen when missing teeth affect chewing or appearance, or when neighboring teeth start drifting into the empty space. Crowns come in several materials: all ceramic, zirconia, porcelain fused to metal, and metal, each balancing appearance, strength, and durability. At the first appointment, the tooth is numbed and carefully shaped so the crown has space to fit securely over it. An impression or digital scan is then taken so the laboratory can build a crown that matches your bite exactly. A temporary crown protects the prepared tooth for a week or two while the permanent restoration is being made in the lab. At the second visit, the temporary is removed and the permanent crown or bridge is checked, adjusted, and cemented into place. Mild tenderness or sensitivity for a few days is common. Most people return to normal eating soon after the fitting. Daily brushing, flossing under bridges with a threader, and avoiding very hard or sticky foods help restorations last longer. With good oral care and regular checkups, many crowns and bridges last 10 to 15 years and often considerably longer. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.